It's time for an updated video about partial Achilles tendon tears. We're going to look at what treatment works best, who or when you may need surgery, also how long you can expect recovery to take and how recovery actually works, how the tendon heals, because that helps you understand what treatments actually work best and why you're doing the things you do. If you're not sure if you've torn your Achilles tendon, we've previously made videos about how it feels when you tear a tendon and how you can know whether it's partial tear or a complete rupture. And we've also made very detailed videos about the treatment for complete Achilles tendon ruptures because it's very different from partial Achilles tendon tears. If you're interested in that, I've put the links to that content in the description of this video, so have a look there. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment of any type of Achilles injury, all done via video call. If you're interested in our service, have a look at the description. I'll put a link to the website there. By far, the most common question we get about partial Achilles tendon tears is, do I need surgery? So I'm starting the video there. And the answer to this is sometimes yes, but in the vast majority of cases, no. I also need to say that there isn't very strong evidence in the research yet to say exactly when surgery is needed and if it is needed, what type of surgery. But the expert opinion at this point says that there are three factors with regards to the tear that specifically may suggest that surgery is an option. The first is the size of the tear. If you've got a large partial Achilles tendon rupture, so more than 50% of the tendon was torn through, then it's thought that you will likely do better with surgery. Also, if your tear is in the upper portion of the Achilles tendon, where it is kind of becoming the calf muscle already, so we call it the musculotendinous junction. I can never say that word. Then it is also thought that those patients will get better function back if they actually have surgery. And then thirdly, regardless of the size of your tear or the location, if you've tried rehab and a properly structured plan, like I'm going to discuss in a minute, where you've really protected it for the period it needed, plus slowly built your load over time, and you're just not seeing results, and your symptoms are continuing, then in those cases, surgery can also be an option and make a difference. Your doctor won't just consider these three factors when they advise on whether surgery is a good option or not. They will also look at other things like your general health. How likely are you to have a good recovery after surgery? The activity levels you want to get back to. There are always many factors that can influence the outcome of surgery. So they tend to look at the whole picture and not just the size or the location of the tear. Understanding how a torn Achilles tendon actually heals is very useful because then you can understand what the goal or the aim is with the different steps in the treatment process. The first thing that happens when you tear a tendon is that there is inflammation that starts. And this inflammation usually peaks within 1 or 2 days. Now, before you reach for anti-inflammatories, the inflammation is actually a really important part of the healing process for tendon tears. It's different with Achilles tendonitis or tendinopathy. That process is a totally different process. So this only applies to Achilles tendon tears. The inflammation is there to clean up the area so that healing can start taking place. It gets rid of all the broken cells and it stimulates the body that it brings blood supply and everything it needs for healing to that area. At the same time, you start forming a scar in that area. Now, scar tissue has gotten a bad name on the internet. Everybody's forever on about, oh, you've got to get rid of the scar tissue. Scar tissue is an essential part of how Achilles tendons heal. And scar tissue can be either functional or it can be problematic. And functional scar tissue is what we in medical terms call scar tissue when it's doing exactly the job it should be doing and it doesn't give you problems afterwards. So I'm going to explain to you how you can get functional scar tissue. The first step in forming scar tissue is that you're getting scaffolding that forms in that gap where the tendon tear is. And the aim of this scaffolding is to bridge the gap and give the new cells something to come and attach to. Now, you could think of it like an internal scab. You know, when you cut yourself, you get a scab, and that's exactly what that scab does for the skin. So this is now happening inside your tendon. It's not hard there. It's nice and soft, obviously, because it's all wet and inside the body. And the first cells that come and attach there are collagen type 3 cells. And these cells aren't very strong. It's not the type of collagen you want yet. And everything is a little bit disorganized. It's not in the nice straight lines because we know in healthy, strong tendons, the collagen fibers are aligned in parallel, and that's what gives it its strong structure. So, the next stage in the scar becoming a functional scar is that these cells have to be replaced with stronger, proper collagen that can withstand the forces you want it to withstand. And the fibers need to align that it goes in line with what the direction the tendon works in. Now, how do you do that? Often on the internet, you'll see claims that people say, oh, they are breaking down scar tissue with their hands and getting it to align. You can't actually change the tendon scar tissue through massage or hard pressure on it. What it needs is it needs to be loaded in the direction that it is going to work eventually. Think of it as pulling the tissue slowly, slowly over time into the direction it wants to be in. And the force from the careful loading is progressively getting the tendon to renew those cells, because the brain, every time you do some exercise that loads it a little bit more, the brain goes, oh, actually, we need that area to be stronger. So I need to replace those cells with stronger, healthier ones. And it slowly exchanges those cells for the types that's more useful to you. So these processes all overlap. Your inflammatory phase starts pretty much immediately after your injury, and it lasts for between 3 to 5 days, depending on the size of the tear. It may be a little bit longer, but it's usually during that period. If it's a very small tear, it might be over within just a day or two. And the scar formation, or what we call the regeneration phase, because we're creating the new cells, starts very shortly after the inflammatory phase has already started. So they overlap. And then we call the process of getting the cells to be replaced with a new, stronger type of collagen plus realigning, we call the remodeling phase. And that phase takes quite a bit of time. It, to be honest, depending on the size of the tear, it can take 6 to 9 months and sometimes even longer. It just depends on what's going on in there. Why do scar tissue sometimes become problematic? Because, yeah, scar tissue can cause trouble sometimes. Well, the first is if it becomes excessive scar tissue. And it becomes excessive when there is really excessive bleeding and swelling in that area. And the most common reason that happens is because people aren't giving that injured area enough rest. They try to train on it too soon, or they're trying to just push through the pain and continue after they should have stopped a long time ago. And it's about giving it the right level of protection, which we'll talk about in a minute. The second is if it goes and attached to other structures around it. So your Achilles tendon lies quite close to other tendons as well as little nerves, and everything is nice, supposed to slide past each other as your body moves. That's how we're designed. Now, sometimes it gets stuck to other structures and then it tugs on them as it moves, and it can cause nerve irritation and all sorts of things. So, but I should also say, if you do have some nerve symptoms early on, it doesn't mean that that's happened to you. It can also just be that the nerve got stretched heavily when it was injured. So don't think that's definitely the cause there. You usually only see that much later in the recovery process, those symptoms come out. So what causes it to attach to other things? Again, it's if there was excessive inflammation in that area, or excessive bleeding in that area, or excessive swelling. So that's why we're on about protecting it and giving it the right level of activity during the early stages, because it's so important for that. Then also, if the scar cells are never replaced with stronger cells because you're overprotecting the area, you're not actually following the right type of loading plan at the right times and building it up to the level that you need for the activity you want to get back to, then the remodeling doesn't really take place, and then the scar becomes problematic. But then Fourth reason is sometimes it's just bad luck. Sometimes you do everything you should be doing to the T, and then you get problematic scar tissue. But the good news is there are ways to deal with that as well. And often, like for instance, if it does attach to other things, doctors will just go in and either do minimal invasive surgery for it, or a very common way is that they just do under ultrasound guidance, use a lot of clean water, fluid, that they inject in between those structures and get it to separate. And then things can be much more comfortable. So don't worry if those things happen. There are things that can be done about it. And even if you might have overprotected your tendon too much at the start, you can always change scar tissue later on still. There's very little research in how long scar tissue takes to actually properly change in tendons, but there's lots of research in plastic surgery, because guess what? People really care about that in plastic surgery. And it shows that scar tissue can still mature and get better up to 18 months after the surgery. So don't think that it is something that is never going to change. It can always change. My take-home message for the healing process is that it's all about balance. Yes, rest and protection is important, but loading and getting the load right depending on the healing stage is equally important. And these should be in balance throughout the period. So I will discuss and explain how you can get this rest versus loading right under the treatment section later on. But let's first look at what your recovery times might look like. For recovery times, it's worth splitting it between two factors. One is the tendon knitted together? How long does that take? Versus how long does it actually take to get your proper full strength back into that tendon? Now, from animal studies, it shows that the knitting back together of the tendon can be seen around 12 weeks for most types of tendon tears. That period will be significantly shorter if you have a small tendon tear versus a large one. So it just depends on that. But usually by 12 weeks, even very large tendon tears are knitted back together. The problem is we can't see how strong the tendon is on any type of scan. The only way that you can really tell whether it is a strong, functional, you've recovered your function in that tendon fully, is by looking at what you're able to do week on week, how the tendon tolerates that. And that includes all the activities you're doing in your life, plus your rehab exercises. Of course, there are many factors that influence how quickly you can regain the full strength in your tendon. The first being the size of the tear, because larger tears, you'll have to take your rehab slower and it will take more time to rebuild it. So with larger tears, it can take 6 to 9 months to get back to full high intensity sport. For your small tears, it can be as quick as 8 to 12 weeks, sometimes even quicker depending on the size of the tear. Then if you think of general health, some conditions like diabetes influences how healthy your tendons are. Also, if you're in the menopause, any stage of the menopause, the drop in estrogen can affect how well or quickly your body can produce new and strong collagen fibers. So that tends to lengthen the rehab period a bit. It depends on how well structured your rehab plan is. Are you progressing at the level that's beneficial for the tendon, or are you causing yourself flare-ups along the way that makes you have to take time off and rest, or are you just being too conservative and not actually loading it enough? And then finally, also if you've had Achilles tendinopathy beforehand and been having a lot of pain with your tendon that stopped you from doing so much activity, it may mean that actually you weren't as strong when the tendon tear happens, so you've got a bit more strength to actually build up to get to your goal eventually. On that note, there's an interesting case report that was written up by a group of doctors who found that in a runner who had a very grumbly, constant, chronic Achilles tendinopathy in the mid-portion, sustained a small partial tear, and after 12 weeks, there was no sign of the tendinopathy anymore. And they think that the inflammation caused by the partial tear actually helped the healing process of the tendon and the tendinopathy as well. So do not see the fact that you've had a tendinopathy for the months leading up to the tear as a problem. It may actually help the healing process of that as well from the inflammation. So it's all about just managing it as best you can. So let's dive into how do you actually treat partial Achilles tendon tears. I want to zoom out first and just look at the total treatment plan for a partial tear. It can be useful to think of it as a triangle. At the bottom, you've got the very initial stage where you've got to protect and rest it. At the top, you've got your goal, what you want to be doing. So it's walking the dog, or it's I want to be able to do endurance races, or I want to be playing paddle. It just depends on what your goal is. And everything in the middle is how you get to that goal. So the protection will slowly decrease as the tendon strengthens, and the loading needs to increase as the healing process takes place. Now, how long you just protect it really depends on the size of the tear and the symptoms. So for large tears, it may be that actually it's totally immobilized for a period of time. While smaller tears, it's just giving a bit of protection to reduce the strain on that small area, but you can start the loading nearly immediately. So how quickly you progress through this triangle really depends on the size of your tear, how your symptoms react to the rehab, your general health, your life, and the activities you want to get back to. Because somebody who wants to just build up to a level where they can walk without restriction, their plan will be shorter and look different from somebody with exactly the same tear that wants to get back to explosive sports, because there's just so much more strength that we need to rebuild. So every plan needs to be designed around the individual, what their life looks like, how they respond, and what they eventually want to get back to. First, we're going to look at the ways in which you can effectively protect your tendon and avoid getting that excessive scar tissue forming. The first thing is the foot position. Now, why is this important? Well, if you think of a tear, if you're going to separate the ends because the foot is in a position that stretches the Achilles tendon, it's going to be more difficult for it to knit together and heal. If you can support it by placing the foot in a position that the Achilles tendon is actually not getting that much stretch and the ends can come together, then it's so much easier to heal. But there are levels of this protection that you need depending on the size of the tear. So for very small tears, it may just mean that you wear a shoe where the heel is higher than the toes. So running shoes, for instance, there are loads of brands. I'll put links to the brands we tend to advise or recommend that has a heel drop of about 10 millimeters or 12 millimeters even. And if you have a small tear, putting your foot in that often means that you can walk around day to day without much discomfort, that you don't even know you have that tear. So that can be enough. If it's a slightly larger tear, you often need to add in some heel lifting inserts to get it to a point where it feels comfortable to walk. If you do use those inserts, again, I'll put links to them in the description, then place them in both feet because they need to be equal. Otherwise, you're going to end up getting other injuries from not being equal with it. We tend to advise patients to use the least amount of lift needed to get them symptom free. Now, I'm not talking about putting these lifts in and going for a run and saying it still hurts. It will still hurt. If you try to walk really long distances with that in, it will likely also still hurt. It's just to get you symptom free day to day in the things you need to be doing, then we know it's getting the right level of protection. You can usually start reducing the heel lifts and the level of lift over time as your rehab progresses, and you will be able to walk more and more and more in those shoes as the tendon settles down and calms down. It's very case specific with these. If you have a rather large Achilles tendon tear, then you may be placed in a boot for a short period of time, again with heel lifts in there. You don't want it in dorsiflexion. You want the heel higher than the toes so that those ends can come together and you can just stabilize things a bit. The second important way to protect it is through relative rest. Now, you often don't have to rest completely when you've got a partial tear. If you can get the shoe option right, you can be as active as you want to be within the limits of your symptoms. If you don't get pain or it feels more uncomfortable when you do something, you can do that with with the shoes and things on. The only exception here is high impact things. So we would usually not advise you to start running immediately or jumping, anything where there's a big force through the Achilles. but walking is usually okay within those limits. Things like cycling may even be tolerated. It just depends on the case. Also, if you want to do strength training exercises, things like if you think of a squat does stretch the Achilles tendon, but as soon as you put something under the heels, so even more than what we've got that lift, a rolled up towel works really well for this, then you reduce the stretch at the Achilles and you can actually do the squat exercise without any strain on that area. Same thing for if you want to do core exercises, especially if you're in a boot, because you'll be limited then. You can't do things like squats and stuff because you really need to be resting it for a longer period of time. And again, the physio or doctor you see will explain to you how long rest period or taking it easy period is appropriate for the size of tear you've got or the symptoms you've got, because it varies a lot. But if you can't put any weight through that leg, doing core exercises, for instance, like crunches or side planks on your knees, where you don't actually put pressure through that leg, can be really useful. And it's useful because it also helps the mental side of recovery. If you love sport or being active and you're just sitting there thinking, well, I can't do anything now, it's so freaking depressing, that's not going to help your recovery either. So it's all about finding that balance with all of the exercise and things you want to be doing. If I have to summarize the relative rest bit, the key here is you cut your activities down to the point where it doesn't aggravate the injury, and that is while you're wearing your supportive shoes and things. But you also avoid the high impact sports at that point until you're sure you've built the strength for that period, for that injury. I want to include some advice about swelling here because, like I mentioned earlier, if you have excessive swelling, it can actually cause trouble with the scar tissue later on. So it's important to monitor your swelling and make sure that it doesn't become excessive. Now, it's absolutely normal to have some swelling when you've torn your Achilles. And if you've got a rather large tear, you may even have quite significant swelling. So here's how you can decide whether it's causing excessive swelling for your case or not. When you wake up in the morning, that is the best your leg's going to look for the whole day, because it's been in a parallel position. It's been easy for the body to get rid of the fluid because gravity's not been pulling it down. And this is the best it's going to look for today. As the day goes on, you may see the swelling increase a bit in the calf and the Achilles tendon area, and that's absolutely normal. It's because your feet are down. So gravity is pulling the fluid down, and at the moment, the muscles can't contract properly as they usually do to push the fluid back up. So what you want to do is you want to look at how swollen are things in the morning, and then how does it look by the evening. If it looks really tight and not happy from the excessive or the amount of fluid that's now in that area, it likely means that you need to be doing something different throughout the day to help the swelling not become that excessive. So what can you do to help improve the swelling? Well, the first is think about all the times in the day that you are spending with your feet down. So that includes long periods of standing as well as long periods of sitting. Now, if you're working from home, that is really easy to sort out, because then you can even take breaks during the day that you just spend lying down on the bed to help with swelling. If you're working from the office, it's a little bit more tricky, but simply having your foot up on something instead of down all the time can be really useful. Also, just moving around and not sitting for hours on end without taking breaks can be quite useful, especially if you've got the right shoes and things on that it's comfortable to walk. There's no reason to not get up every half an hour, just do a little bit of a walk to help that fluid. But then thirdly, you could also use ice, especially in the evenings if you see that the swelling is a bit of excessive, to help reduce it. Now, before everybody jumps in the comments and tell me, but ice is bad for healing because it inhibits inflammation. I know that message is being shouted out over the internet, but it is not based on any human studies, and the animal studies out there is actually showing an opposite message. So here's what the studies at the moment is showing. Yes, ice for short periods of time can actually reduce swelling in animals. There isn't any evidence from humans. But if you use excessive ice and cool it excessively over a long period of time, then it can be bad for healing. So again, it's about getting the balance right. icing your Achilles tendon for 7 to 10 minutes, removing the ice for about 10 minutes, and then reapplying it for only 7 to 10 minutes is not excessive cooling. And it's going to help your swelling. It's not going to stop your healing. So please don't be worried about using ice, but do use it in a sensible way. You're not meant to be putting your leg on that while watching TV, and then 3 hours later, you realize it's still being cooled. So it's all about the balance there. I should also say it's not a good idea to use ice if you actually have an open wound in that area, or if you don't have normal sensation. If you've got any nerve issues in the leg that means that you can't feel as normal, then it's not a good idea to use it. Medication is also something we need to talk about here, because people often grab anti-inflammatories during the early stages to help with pain, or they may have been told that it helps to get the inflammation under control. Now, we've seen that inflammation plays an important part in the healing process, but again, excessive inflammation can be an issue for the scar tissue. So it is about the balance. The vast majority of cases should not need anti-inflammatory medication, and it's best to stay away from it. If you are struggling with a lot of pain, then icing that area, like I spoke about earlier, may be a better option. If, however, you have excessive inflammation in that area, then your doctor may suggest that you use anti-inflammatory medication. And it is not a problem if you use it for a short period of time to get that excessive inflammation under control, because then it actually helps the healing process and brings it back to being just a normal level of inflammation you need. But it is not a medication that should be used routinely for all Achilles tendon tears, and it should not be used for longer than what you need it for to get that excessive inflammation under control. Now we get to the component that people are usually most interested in, and that's how do you actually rebuild the strength in the tendon. So like I mentioned earlier, loading is extremely important for the tendon to get functional scar tissue and build the strength over time. But when I say loading, don't just think of calf raises. Yes, of course, calf raises and specific Achilles strengthening exercises do form part of this, but it's also about all the activities you do in a day that load and uses your calf muscles and your Achilles tendon, because they work as a unit. So you have to look at both those components when you look at the rehab plan, because all the load you put through the Achilles in a day counts towards the total load. And when you have an injury, there's only a certain amount of total load that injury can take at that moment. So how do you know what that is? The first step in getting the loading right is actually finding your current baseline. There tend to be 4 main things you're looking for when you're trying to establish your baseline. The first is just day-to-day activities. How much walking and standing is my tendon happy to tolerate at the moment? And I'm not talking about that you feel, oof, I've pushed things by the evening. It's got to be comfortable doing that level. Then, how much general exercise can it tolerate and what types? So we're thinking cycling, swimming, low impact sports. And obviously this depends on the size of tear you have, whether this is even appropriate to think about at this point. And then thirdly, what type of Achilles specific loading can it tolerate at this point? So this can vary quite a lot. The baseline for somebody who's got a large tear, who's in an orthopedic boot, will be actually no Achilles tendon loading at this point. Whereas somebody with a really small tendon tear can perhaps even start with some weight-bearing exercise like double leg calf raises. It just depends on what's appropriate in that situation. And then the fourth element is, how much support does my tendon need when I do these things, especially the exercises? So if you think of it, if you're currently wearing a shoe where the heel is higher than the toes for your day-to-day tasks, it's not appropriate to go and yet do your exercise over the side of a step necessarily in those early stages, because then you're going to get the stretch that you're trying to protect it from. So you'll be starting with your exercises just to floor level with your shoes on, for instance. This can change throughout the rehab process when your physio wants to start getting the tendon used to very controlled bits of going to the stretch position. But especially for the baseline, you want to match the level of support you're giving it in your day-to-day activities. Getting this baseline right is actually quite important, because it gives you just the right activity level to allow the injury to settle, the knitting together to start, and get the whole process of remodeling off to the best start possible. The obvious second step is the gradual reloading. Now, this will look very different, obviously, depending on the size of your tear and whether you're in a boot versus just in a shoe with some heel lifts. But again, we've got to think about general activities that load the Achilles tendon, like your walking and things, plus your sport, plus your actual Achilles strengthening exercises. And this all, the total load from these things in total, day to day, as well as over the week and over a month, should not increase too suddenly for the size of tear and your ability, because otherwise we'll get flare-ups. So if we think of just general activity, the easiest thing is to start increasing walking distance usually. You can change the terrain from flat to a little bit more hilly. You can change the speed, for instance. If you think of Achilles loading exercises, it will be things like, say, for instance, you had to start with exercises that you were sitting in a chair only with no weight. You'll progress to standing double leg exercises, no weight, adding some weights. Maybe you'll go on to single leg with weights. You may progress from just to floor level to overstep, but each person's starting level will be different and their progression will be different. And for somebody with a very small tear, they may even get back to jumping and hopping type exercises and integrating running within a few weeks, versus somebody with a large tear will have to usually only integrate those things around 6 months. But again, we will only integrate the jumping and hopping exercises if you actually want to get back to those type of sports that needs that. If you just want to get back to walking the dogs and it doesn't interest you at all to do any explosive sports, then you won't be getting those exercises. Your physio will establish during the assessment and all the reviews they have along the way to progress your plan what the right exercises and progressions are for you. So the plans should look very different from person to person because it has to be individualized according to how the person progresses, how they tolerate things, and all the other factors in their life. There are a few injections that are thought to help the healing process. The first is PRP injections, platelet-rich plasma, where they spin your own blood and get the plasma with a lot of platelets in there to inject into the area. And the thinking is that that stimulates the healing process. Now, there isn't any research really into whether it really helps partial tear healing. There is some research for complete ruptures that suggest it might be useful, but again, it's not clear cut. So we don't tend to advise all our patients to get PRP injections because we see them recovering quite well without it even. But if you're struggling to recover, then it is something we might suggest. And it's definitely something I would try before I opt for surgery. Stem cell injections is also something that's being mentioned more and more and more. At the moment, there's really very little evidence on humans that it works for any type of Achilles injury. So it's not really something I would go for at this point. I would actually go for the PRP rather than stem cells. Corticosteroid injections is one of those that I would definitely say avoid. Yes, it can reduce pain really well in the short term, and that's why doctors sometimes use it, but it's really bad for tendon healing. And this is not the type of thing you want to be putting into that area when you want a partial tear to heal. Brilliant. Hope you found that useful. If you've got any questions, just ask them in the comments. And if you need more help with your Achilles injury, you're welcome to consult one of our team via video call. The link to the website is in the description of this video. Take care.